And joining us now is Ben Money. He's the Deputy Secretary for Health Services with the state's Department of Health and Human Services. Thank you so much for joining us. What can you tell me as far as DHHS is concerned about the efforts to get the vaccination process moving? I know it's been a little bit slow to start, but I know you guys are working to kind of ramp that up as much as you can.
Actually, we've been ramping it up very quickly. It's been an all hands on deck effort. I think it's important to remember the vaccines didn't arrive until like right before Christmas. And we were working through the Christmas holidays, working with our healthcare partners, our hospitals, our local health departments, enrolling new providers to be able to administer the vaccine, assuring that our allocations were correct to be sure that the federal government was distributing the vaccines appropriately to our healthcare providers, making sure that their systems were in place. So a lot of work has happened in a short period of time, and we're really seeing an acceleration in the number of vaccinations that are being delivered and received by patients.
Okay. And are you all planning, are you taking this one step at a time as you get more doses of the vaccine, or is there a broader 1 year, maybe 18-month plan as far as getting everyone vaccinated?
Oh, it's a week-to-week plan. We're actually developing new approaches to getting vaccinations in arms, working on mass vaccination clinics with our healthcare partners and our local health departments, getting our federally qualified health centers on board to serve our historically marginalized populations and communities across the state, making sure that the vaccine supply is distributed in an equitable way. So a lot of work is happening, and we're very pleased, although we know that there's a lot more that we're going to be doing to make sure that we can get vaccines in arms as soon as the vaccines arrive in our state.
And you mentioned equitable distribution. I know the state has the 4-phase plan that has different groups like people older than 75 and frontline essential workers. Are there provisions in that plan for either minority communities or other minorities that may be more susceptible to the virus to kind of make sure that they get a little sooner?
That's it. We recognize the fact that individuals are at different risks for exposure to the virus, as well as severe complications if they do contract COVID-19. And we factored that into our prioritization. So when you look at that first group, it includes all staff that are working with COVID patients in hospitals and the staff that are in long-term care facilities. And one of the things that we find is, and that includes people that are, delivering food, making up beds, cleaning their rooms. We want to make sure that vaccination gets to everyone that has a high risk of exposure. And one of the things we find with our long-term care workforce is that they are comprised very much of people from historically marginalized populations, Black and Brown people that provide patient care. So assuring that they get vaccinated early on, as well as our frontline and essential workers, which are also disproportionately highly represented in Black and Brown communities.
And, you mentioned addressing it as for frontline workers and such. But Dr. Cohen this week noted that there are reports that some people working in nursing homes and long-term care facilities are actually turning down the virus. Are you all seeing kind of widespread perception issues as far as the vaccine is concerned? And do you all have plans to address that, especially for African Americans in particular?
And, I wouldn't say they were widespread. What we're hearing are folks saying, I may pass on this time, but get it the next time. We want them to get it the first time that their spot is available. And so we've been working with a variety of community groups, faith leaders, to get clear information out about the vaccine, to address any misconceptions that people have about the vaccine. To let them know that the vaccine has been tested very widely in clinical trials, utilizing more volunteers than have been seen in clinical trials for vaccines in years. This is an effort that has been a worldwide effort, and it's been an effort that has utilized the science that's been available. And it's put together teams of organizations and groups and academics to make sure that we can address COVID-19 through the best science that's available. And one of the things that we found through these clinical trials is that the vaccine is safe, that it's effective, over 95% effective. And that when people do get the vaccine, they have very minimal and temporary side effects.
Well, I'm sure you all are going to, as you said, continue adjusting your approach. We greatly appreciate all the work that you all are doing to keep us safe. And please stay safe yourself as well in the new year. Thank you for joining us, Ben.
Thank you. Thank you, Josh.